Good afternoon, everybody. This is Travis Bethel, HI Health Home. Welcome to the October office hours. So, thank you for attending today. So, we'll get started and jump in here. We're going to do some policy and procedure updates today. We'll talk about the especially mental health CMA designation process, touch on COVID-19, NetSmart related, and then Health Home Plus business intelligence plan, and then an update on the core heart process. Before we get going, I just wanted to let folks know that this is being recorded and it will be available on our HI Health Home trainings page in the near future. And if folks have questions today, you can unmute along the way or type into the chat function. Okay, so we've had a handful of policies and procedures that we had sent out over the last day or so. In particular, they're the Children's Plan of Care, the Health Home Outreach and Engagement, Notice of Decision and Fair Hearing, Health Home Plus, SMI and AOT, and the Staffing Qualifications Policies. In particular, the Outreach and Engagement Policy, which I had sent out earlier today, actually, that just has a change in some language on the quality performance section in the policy. So it's just really language change there. It's not really specific to the outreach and engagement principles themselves. It's more about quality follow-up. The Health Home Plus SMI and AOT policy, that's specific to a change in September of this year to expand eligibility criteria for Health Home Plus to include folks discharged from state psychiatric centers, and those released from Central New York Psychiatric Centers and its corrections-based mental health units. So that's just expanding that eligibility component. And then staffing qualifications, notice of decision and fair hearing, and Children's Plan of Care. They have updates, particular to Children's Plan of Care is around results from our Health Home Serving Children audit that was conducted. So Jessica worked with others to update that policy. Notice of decision and fair hearing had specific to the children's DOH Form 5288 for discontinuance of children's waiver. So that's a new form that's located within that policy. And then there's some language in the staffing qualifications policy that was updated around the children's waiver audit as well. So didn't know if anybody had any questions specific to those 5 policies that went out at this point. No? Okay. Well, if you do, as always, please reach out. We have a few that are coming up the pipe here. Children's waiver is going to have policy update for that specifically. The heart process we're going to be working on as well, considering that there's some more information that's going to be coming shortly, which I'll touch on in a little bit. And the quality assurance and performance policy will be updated as well. Next, we just wanted to take some time to say great thank you and congratulations. Our network has a number of organizations that were provisionally designated to work towards designation status for Health Home Plus. And we're really, really happy and proud to report that as a network, all the organizations that were provisionally designated have gone to full designation status, and they're going to be receiving memorandum shortly, if they have not already, from OMH indicating that has happened, which we find to be just outstanding, because there's so much work involved, as folks know, with working with the Health Home Plus population, and this process, identifying members and then locating and continuing to engage and support them can be particularly challenging from time to time as well. So we really appreciate all the efforts. As a network, we're crushing it. We're really doing a great job identifying those members and serving and supporting those members. So we just wanted to pause and thank everybody for such great work. So we have some new information around the COVID-19 disaster emergency. The commissioner of OMH just extended the waiver on October 23rd, so this past Saturday, for an additional 60 days. We're still waiting for guidance specific to the Health and Plus piece as far as the face to face, but we're going to continue to work under the assumption that those flexibilities for face to face remain during this extension, which would go through October 24th through December 22nd of this year. So we're saying at this point that, if you're not able to, and we're apologizing that this keeps changing, but we're going by, OMH and the federal waiver standards, and we're trying to get information out as quick as we can. We were just saying in the last week or so that as of the 24th, that face-to-face contact had to occur for those two face-to-face for Health and Plus members. Otherwise, you could not bill at that rate. But at this point, given the fact that the commissioner signed on October 23rd an extension for 60 days, we're going under the assumption that we're able to continue to bill at the Health and Plus rate for those members that we are not able to see face-to-face for those two required times in a month. But that's with the caveat that it's highly encouraged that those face-to-face are seen each month for those folks twice a month. And if you're running into barriers, that those barriers are documented in the member's record. And that's coming off from that August 4th memorandum that was put forth. So even though the extension has come from the commissioner, that memorandum from August 4th is still really stressing the fact that face-to-face should be put in place as much as possible, as appropriate, as long as it's safe and there's not health and safety risk involved. And, if you can't, that you're documenting in the record the reasons why you weren't able to. On this particular slide, I just wanted to share with folks the actual memorandum, the waiver, I should say, that Commissioner Sullivan from OMH signed off on the 23rd, extending that 60 days from October 23rd. So you can see the language there as you're looking through it, that we're feeling comfortable at this point to go under the assumption that we can continue to bill for those Health and Plus interactions if they are not face-to-face. But we are looking to get more information from OMH/DOH to specify that is also inclusive of Health Plus members. Is there any questions around this? Again, we apologize for the changing information, but we're really going off from as we're getting the information. This actual waiver we just came upon today, actually, late morning, so we're getting it out, as soon as we can here. No questions, thoughts, concerns? Okay. Please reach out if you have anything, and we'll do what we can to help clarify and answer questions for you. We put this up last office hours. We wanted to bring it up again, and it's really just member programs and NetSmart to add folks. The example here is the Health and Plus program. If somebody's enrolled in Health and Plus, that they really, they should be identified as Health and Plus program, and that's in the system. You shouldn't have an end date unless that person's no longer in that program. There has been question in the past, well, that's how we're tracking our Health Home Plus status for folks. The Health Home's urging folks to take a look at using the task option within NetSmart to do that, so that you can use that as a monitoring tool for folks that are Health Home Plus, if you're specifically looking to monitor that time frame that they're in that status. But we're really looking to, it's creating a lot of issue on the back end for as far as pulling systems and reports. If we've got programs in there that have an end date, but yet they're still going. So we're just asking that people, refrain from doing that. And then the last piece is if you could go into NetSmart and remove the future end dates that are populated for all active Health Home Plus members that you might have in the system. folks have any questions or thoughts around that, or any more clarity that they wanted?
Travis, this is Lori. Do you have a report that shows that, or do we need to, manually look at each Health Home Plus to make sure there's no end date?
It's a great question, Lori. I'm going to kick it to our data team, Taylor or Ann. I didn't know, or Tazine, if you're on, if that's something we'd be able to pull as a report for folks.
Hi, Travis, it's Taylor. Yes, we should be able to pull that. I will look into that as soon as we get off and let you know.
Thanks,
Thank
Taylor.
you.
Yep, you're welcome.
Then I had a question in the chat here I just wanted to touch on. Can we assume that a waiver could continue to include telephonic completion of the assessment if needed? So at this point, we're going under the assumption that all the waivers are intact because the public health emergency has been extended through the federal government. DOH and OMH, OMH just sent out that memorandum that I just discussed and shared, and DOH has indicated that the waivers are going to remain intact until further notice. So we haven't gotten any other update from DOH indicating that that's changed at this point. So the assumption is that we would continue with those waivers at this time. With that caveat that if we're able to see people and to complete those plans, get those documents signed in a timely fashion, that's the priority if we can do so. But telephonic is able to happen in the event that those face-to-face actions can't. Does that help clarify that? Okay, great. Okay. Then our data den update, we've started to do a soft rollout with a couple organizations, and we're going to expand that to more and more organizations. And really at this point, it's for the focus of ensuring that data, because we've done testing within our internal CMA, but we also want to make sure that it's accurate data for our partners that we're working with. So we're doing that soft rollout in those instances, and we're working through those scenarios with the idea that we're going to do a network-wide training. And I know that was going to come up earlier a few months back, but we decided to pause because of the importance of ensuring that the platform and the data is what we want it to be, not only as a health home, but for our partners with their feedback from the network. So we're trying to be really, thoughtful in our process in doing this. So it's a continuous discussion at this point, but there's more to come. We're excited for this to come forward because it's been quite helpful. I can just speak from the internal CMA standpoint. I found it to be very helpful just to identify what plans are coming due, when they're coming due. I know those reports come out from our data team, which are very beneficial for us as a network. But it's really nice to be able to log in and click and just see it like in real time for the most part. I mean, this is data that's updated pretty frequently, and it would be at your fingertips, versus waiting for a report to come out on a monthly basis and having to be pulled from multiple sources. So it's going to save a lot, not only from our data team for the back end once it's up and rolling smoothly, but it's also going to help us doing the day-to-day work to see where we're at more real time as far as those documentation pieces and how our enrollment numbers look and the types of programs that are enrolled with us, et cetera. So it's going to be a nice tool. Anybody have any questions or anything about data den? I know that preliminary overview, I think it was early summer, June-ish, possibly July. Some folks gave feedback that it was kind of a lot up front, but the intention at that point was hopefully show folks that there's a lot of capability with this program that'll help our lives be much easier when it comes to those paperwork components. Okay. Then I want to talk about core and heart programs. So October 5th, CMS approved the core services, and I put the definition here to be helpful for folks. What that stands for, and that's community-oriented recovery and empowerment services. And so OMH is really excited to talk about this. They're going to be putting forth trainings, which they're saying that they're going to primarily go through the MCTAC listserv to identify those trainings. But as I start to see them, or we start to see them as a health home, we'll try and get them out to the network as timely as we can as well. I haven't seen anything come out specific yet for health homes and care managers, but our understanding is that's going to be before the end of this month that those training dates will be put forth. And really what it's going to look at is a go live date of February 1 of 2022 for core, and to talk about what is the core services going to mean, what's that mean for like HARP now, and for those folks currently enrolled in HARP. And then my understanding is the HARP plan of care and the HARP assessment workflow will remain the same, but there will be more discussion about that for folks. And then there's going to be a piece in there in those trainings that's going to really look at the behavioral health HCBS components that are going to be available for HARP members, and then 4 new programs, HCBS programs that are going to be, or services, I should say, that are going to be added to that workflow, which is quite exciting, especially on OMH's end. And it's going to offer more variability for folks. And so there's more to come. Those details will be coming out more soon, but I just wanted to get that out to folks if you haven't got this type of information yet. I know we've been waiting quite a while to get it. And, that official approval from CMS just came through. So that's great stuff. Anybody have anything that they wanted to talk about around the core and HARP at this point? No? Okay. Well, again, business as usual for HARP members at this point. That's not changing, until we get through these trainings and if we hear otherwise. But those workflows will remain the same at this time. I think one of the pieces with this delay was the timing of core and how that lined up with HARP and how that fell into the actual waiver itself and the federal guidelines around the waiver and what they were able to approve with core versus HARP. So there was a lot of that regulatory back and forth that put things on ice for quite a while. And as a result, this is what came back, that there would be core with additional 4 HCBS, behavioral health HCBS services that would be intact as of February 1 of 2022. That's all I had today, unless anybody had any questions or anything they wanted to talk about. A quick meeting today.
Too much rain, everyone's sleeping, Travis.
I know. I like sleeping in the rain too. It's nice. Not in the rain, but during rainy days anyway. I suppose if you're tired enough, you'll sleep anyway, right?
Yeah.
Well, thank you all as always for all you do. And congratulations again to all of you that are going through that SMI specialty status and moving towards designation. It's hats off. Nice job. All right, everybody. Have a great day. Thanks so much.
You too. Thanks for everything.
Thank you.